Hi, I'm Kara Gooding. I'm a physician assistant. I practice in Chandler, Arizona at the Center for Dermatology and Plastic Surgery. I'm here at the Derm 2026 conference for NPs and PAs here in Las Vegas. And one of my talks is on decoding the pink bump. And so sort of understanding when a lesion is benign and when it is malignant, because when we are faced with a patient that comes in that has a pink bump, they're some of the most challenging bumps that we see because they are hypomelanotic or amelanotic. So they're really, really challenging. We can use dermoscopy, but it's not quite as helpful as it is with pigmented lesions. And so oftentimes we're using things like the history of the bump, how long it's been there, the location on the body, whether it's bleeding, whether it's painful, whether it's itchy, have they tried any treatments, and that may help us to guide whether we're gonna biopsy the lesion or not. But really what was the impetus for my lecture is that I've had two patients that have presented to the clinic in the last year that have had Merkel cell carcinoma, which is the most dangerous type of skin cancer that we see. It's highly metastatic. Oftentimes by the time we found it, even when it's only been there for a short amount of time, it's oftentimes already metastasized, which is the case with both of my patients. They are both patients who've had lots of skin cancers. One came in with a lesion on his cheek. It had only been there for about 3 weeks. Looked just like a squamous cell carcinoma. This was a lesion that had already metastasized into his lymph nodes in his neck. And the really interesting thing about Merkel cell carcinoma is that it is sometimes microscopic, and so you don't see it on CT scans. So this patient actually was CT scan negative, but then had a sentinel lymph node, which was positive. So that patient then went on to have radiation to the area and surgery, as well as immunotherapy. So Merkel cell is a really interesting tumor. It's oftentimes associated with Merkel cell polyoma virus in about 80% of the cases. And of course, UV radiation plays a huge role as well. So you see an increased incidence of Merkel cell carcinoma. Like the further you get closer to the equator, you'll see a little bit higher incidence, but it's typically something that you'll see in patients who have a lot of sun damage. It's more common in older white male patients. But the bottom line is, if you see a pink bump, stop and think. Because some of those lesions that you think really look innocent that we see every day in the clinic, things like nevi, dermatofibromas, even warts, oftentimes can be mimickers of things that are far more dangerous and potentially life-threatening for these patients. Other pink bumps that we oftentimes need to be very concerned about are melanomas. So you can have an amelanotic melanoma that can present as a pink bump. Again, sometimes an invasive lesion that could be a life-threatening lesion that you certainly don't want to miss. And so the highlight of my lecture is I do have a lot of cases that I'm presenting, my very own patients that I've had over the last many, many years of seeing patients. And so we kind of are decoding which ones are the pink bumps that are benign and those that are cancer and potentially metastatic lesions.